Thank you, Lucy. And yeah, hi everyone, welcome to our session. So this is the Levers and Barriers to Essential Services session. Fantastic to have you all with us. So my name is Catherine Richards. I'm the brand new Director for Programmes and Advocacy at the Consortium for Street Children. I'm in week 2, so I'm loving meeting so many of you through these network forum sessions, and we have a really brilliant session lined up for you over the next hour and a half. So it's great to have you. I'll start just with some housekeeping. So we have, as those of you who've been in a few sessions already will be familiar with some of this, but to let you know, the format for this session is we have some great speakers who I'll introduce you all to shortly, and we will have time midway and at the end for questions and answers. So if you'd like to ask a question to any of our speakers, please write it into the Q&A box at the bottom of your screen. Or if you'd like to ask a question out loud using your voice, then you'd be very welcome to as well. But just let us know through the chat function or message our tech guru for this session, Lucy Rollington, and we can unmute you to enable that. Please also feel free to use the chat function to introduce yourself, ask any technical questions you might have, or share resources. But I think a few people are starting doing that already, which is fantastic. If you're active on social media, and I hope you are, please don't forget to use our hashtag, which is hashtag CSC Network Forum 2021, and then you can tag us and also follow that hashtag to just find out all the news in the Network Forum. And then finally, just a reminder to everybody that this session is being recorded, like all the other sessions, and we'll be sharing the recording with network members after the forum closes. So if for any reason you're not comfortable with being recorded, then I would suggest that kindly if you leave the session now, but otherwise we will continue on with recording. That's all the housekeeping. So more excitingly onto this session, we will be reflecting on our theme for this year's International Day for Street Children. So this year, as many of you will know, we focused on step 3 of the 4 Steps to Equality campaign, which is access to essential services. And through this step, we're calling for access to the same essential services, such as hospitals and schools for street-connected children, as every other child has, so that they can reach their potential. So this session really focuses in on that. It also provides us with an opportunity to really think about our focus for next year as well, where we'll be focusing in on step 4, which is the creation of specialised solutions. And we'll be hearing about the specific things that partners have done and learned through their programme delivery as throughout this session. So by calling for specialised solutions, that means that we're calling for the delivery of specialised services and opportunities that tune into the unique needs and challenges of life for street-connected children, to keep them safe and to improve their lives. So that's access to essential services, the creation of specialised solutions, step 3 and step 4 of the 4 Steps to Equality campaign. Of course, as many of you will know, it's important to remember steps 1 and step 2 of the campaign, which is to commit to equality. Step 1, which is the importance of recognising street-connected children have the same rights as everyone else and reflect that in law. And step 2, to protect every child, protecting street-connected children from violence and abuse and ensuring children have the same access to justice when they are harmed. Okay, so that's just a bit of context of how this fits into sort of all the wider work that we're all involved in. So today we will have 5 fantastic presentations from consortium members based in India, Nigeria, Sierra Leone, Pakistan, Ghana, and Uganda. We have our first 3 speakers will be sharing learning from frontline projects that they run, which really help street-connected children to access vital health and education services. So I'm delighted that we have Sanjay Gupta from Chetna in India, and we have Sally Udoma from Child Lifeline in Nigeria. We have Santigi Bayodimbura from We Only Child Foundation in Sierra Leone. And then for our second set of speakers, we will share, they will share how they've been taking forward advocacy activities to try and facilitate long-term change. And they will include some really inspiring examples from the International Day of Street Children. So in our second part, we'll be hearing from Sister Olivia, from Safe Child Advocacy in Ghana, and Iftikhar Mubarak from Search for Justice Pakistan. So this session overall has been designed to share learning and best practice. So I really encourage all of you to sit back, soak in the experience that you're about to hear from our fantastic speakers, and importantly, be ready to prepare your questions. And ask anything that could help you with your own program development and advocacy plans, or anything that comes into your head related to what you're hearing at all. And we'll save plenty of time for those questions, as I say, midway through and at the end. Only thing left for me to say is, speakers, just to remind you, please do let Lucy know when you're ready to go on to the next slide as you are presenting, because she will be controlling those for you. So with that, I will hand over to our first speaker, Sanjay from Chetna in India. Over to you.
Thank you so much, Kathleen. Thank you so much for this nice introduction, and I'm feeling like a opening batsman in the cricket team. So I take this pleasure to welcome you all, and thank you so much for this opportunity. Quickly take you to what is our learning from education, and especially in health for street connected children. So let me clear my screen. Okay, that's good. So this is Chetna NGO, Childhood Enhancement Through Training and Action, which is working in Delhi, which is national capital. And we have many children on the street here because this is a big city. It attracts many children. Next, please. Next slide. So what I'm going to present is what are the good practices. Especially, I am presenting a contact point model, which is like a alternative education process, where we actually help children who are living in slums, near slums where they are in more vulnerable situation. They are not going to school for a variety of reasons, and how it is a low cost affected model which can help many children across the world. Next, please. Next slide. Yes. So in this Chetna's contact point model, what are the major highlights? First is that these contact points are safe places in areas where there is a large number of street connected children. We have many slum areas, and we try to choose a place which can be a park, under the tree, near any place which is a public place, probably cemented or very comfortable for children to sit. And then each contact point will have presence of 20 to 30 children who lives nearby. Then it has an element availability, accessibility, flexibility in approach and well-being. For example, a place where there is no disturbance, children can access easily, and is slightly, though it is near the slum, but slightly away so that there is no disturbance. Children are engaged in education and other constructive activities right at their place. This is very interesting. When they come on this place, we have various processes where they are given books, crayons, colors, and we have a worksheet model. We already have a curriculum which is designed by Chetna to get the idea that there are many children on the street. So what are their learning strengths based on that? Then it is holistic approach education in this entire process, and there is an involvement of different stakeholders like parents, community members who lives nearby. So we have a concept of parent meeting, we have concept of stakeholder meeting. We also try to engage with the older peers who have already been to school so that they can come and mentor these children. So in total, this is a very, very useful model, very low cost. Next slide, please. So the reasons why these the challenge is basically why the children are on the street, because of poverty, which becomes a major barrier. The population who comes to cities like Delhi are mainly migrated population. The parents come for employment, and the children they get left over, so they just move around with no work. So basically, and whenever if someone try to take them to school, always there is a scarcity of money for which they are not able to. So this becomes the major barrier. Then a lack of legal identification. For example, if you want to go to school, you need to have a in every country there is a social security number. Similarly, we have in India called Aadhaar card, which is now mandatory to avail education in the system. So these children and their families have no access to these documents. I'm not saying 100%, but most of them are not having any access, and hence that becomes a barrier. Similarly, there is a kind of stigmatization in the school systems. Sometimes peer may use derogatory names for these children. You are from poor family, you are a beggar, you are a rat picker, you do nothing, you are a casual labor. So these are something, and also sometimes because they may not have a good clothes to wear, and if they go to school, people may say that you are little stinky, we do not want to sit next to you. So these kind of stigmatization among peers, sometimes from the teachers end. So the children are not encouraged. And some of the issues like probably the girls do not have access to toilets because it is mainly the boys dominate even on the girls' toilet also. And also if the girls are at the age of 12 plus and they have started their menstruation cycle, very difficult for them to go to for those 5-6 days. Similarly, they are already engaged in child labor and other work. So if they leave that work, means losing the wages. So these becomes some of the challenges. So now I'll take you how we have overcome it. So next slide, please. Like already discussed, these are just the pictorial depiction. Now in this slide, if you can see, we have tried to showcase you different models by pictures. So I am taking clockwise route, starting from mobile education vans. These are specially designed education vans, which are a big carrier vehicle which carries all the education stuff, nutrition, health, and it is very well equipped with the TV and also monitored through CCTV cameras, and where you can see children can sit on left and right, and they can study, and mainly good for children who are actually in begging on streets near traffic signals. Very good model. So this we are experimenting with 4 vans in Noida, which is a satellite city of Delhi. Then open basic education system. Open, if you can see, there are children holding their certificates. This is a very good model where the government of India has provided provision. If you are not even able to go to school, you can still go to, you can still continue your education through open basic education. Then making child-friendly schools is a very good idea. Like I said, there is a system where the presence of children are not accepted. So we try to train children, train peers in the school, and give them kind of child rights training. Can you please move it is a little bit up so that I can see the down thing. Yes, no, it's not this one. I cannot see the screen. Written something at the down. So, okay, so I cannot see the maybe.
Sorry, Sanjay. I probably can't edit the PowerPoint whilst it's being showed.
Okay, so I can try to see in my mobile, which again I cannot see. So okay, so non-formal education, I can see I am referring now the right one, which I can see. Non-formal education, preparing children for school admissions. So this is also a very good activity where you try to give emphasis on children who are who want to go to school and not able to. Yes, if you can just move it up, that's fine.
This one or this one?
No, this one only. This one only, which I am referring. Just quickly up, slightly up, so that I can see what is in it now. Okay, so non-formal education for children, and then enrollment of these children into the formal school. So this is how there are various approaches to one problem. that children are not going to school. So we have a variety of solutions for the same problem. And that makes Chetna very unique in its approach. And every year, I can just give you some scale. 3,000 children are admitted in last 3-4 years, and of which approximately 90% retained. Similarly, through this education van, we are trying to approach 700 children per day, which is again a good outcome. Similarly, in open basic education, every year 200 children get admission, which is our maximum limit. Similarly, in the non-education contact point model, we engage approximately 2,000 children per day at different locations. So that is the model which I wanted to present for today's consultation. I'll be very happy to take a question at the end. And thank you so much for this opportunity. Over to you.
Fantastic. Thank you so much, Sanjay. There was a wealth of experience shared there. Really, really appreciate it. So we will, as you say, we will hold on questions just for now. And we'll hear from Sally at Child Lifeline first, and then we will also hear from Santigi, and then we will have time for questions on this part. So thank you so much, Sanjay. Sally, if I can bring you on, I'd love to hand over to you for your presentation.
Yes, good morning, everybody. I apologize, my video doesn't seem to be coming on, but if we could go to my first slide, which is the next one. Right, so I'm with Child Lifeline in Lagos, and I'm just going to be telling you a little bit about one of our projects, the Oworo Back to School project, which has been supported by Red Nose Day USA through the Consortium for Street Children. Next slide, please. So Oworo Shoki is a deprived area of Lagos with a lot of street-connected children, hawking, scavenging, begging. Although state schools are fee-free, but the level of poverty is such that parents can't afford the basic things like uniforms, PTA level levies, books, etc. And so many children have either never been to school or they drop out early. So this project has a target of getting 100 out-of-school children back into school over a 3-year period. We're now entering our 2nd year of the project, and we are currently supporting 64 children that we have got back in school. Next slide, please. So what are the barriers to accessing education? Well, poverty is the overwhelming barrier, first and foremost. As I said, even though government schools don't charge school fees, there are a lot of other costs associated with going to school that the parents just can't afford. And then in terms of family attitudes, in a lot of cases, the parents actually rely to some extent on the income that the children bring in from begging, scavenging, running errands, etc. And they themselves are poorly educated and don't always appreciate the opportunities that education can provide. Then getting through the bureaucracy of registering children for school can be a minefield for the poor and the poorly educated. You need birth certificates, which many children don't have, many adults don't have. You've got to deal with the state universal board of basic education and schools to get placements, and all of that can be very challenging for the poor. And then for this particular project, COVID-19 restrictions were a challenge because firstly, schools closed between March and the end of last year, March 2020 and the end of 2020. And so what we did there was to start remedial classes for the children. And then, of course, we had safety concerns for our staff moving amongst the community. We didn't have any vaccinations in Nigeria until this year, March this year, and even now very few people are vaccinated. Next slide, please. Next slide, please, thanks. Okay, so now I'd just like to talk a little bit about the levers that we used in helping to overcome some of the barriers ahead of us. So one of the most important was collaboration and engagement. So we engaged with leaders in the community and made them stakeholders by explaining to them what we wanted to do before we started the project. We enlisted their help to identify the children most in need. We engaged them together with our staff in talking to parents and families, and engaged a member of the community nominated by them as a liaison officer. We also appointed 2 parents from amongst the Parents Forum to help disseminate information to other parents in advance of gatherings and help to mobilize them, because initially their level of engagement was low. And then we hold interactive seminars with parents on good parenting, child protection, nutrition, etc., which gives them an opportunity to air their views and concerns or to seek advice. So this built up trust and got a level of commitment from them, from the community. And in fact, they found the venue for us to hold our seminars and our remedial classes in a church hall locally. Next slide. Another thing is that we need the support of the families to keep the children in school. And we recognize that the parents also need help. So we organize regular classes on basic crafts and vocational skills to help the family income stream. And if we can, we try to address individual needs. So for instance, we rented a small apartment for a disabled father who had 2 children that are in the program. They were homeless and living in an abandoned building, and gave him a small amount to start a business as a cobbler. Next slide. We also use our networks to keep abreast of any opportunities or services that we can pass on to the families and the communities that we deal with. So for instance, we were able to connect the mother of one of our beneficiaries to another NGO that was able to give her a grant to restart her business that she'd lost, having spent a lot of money on medical bills. When we learned of another NGO that was organizing free health checks in a hospital not too far away, we were able to pass that information on to families and encourage them to attend those free health checks. Next slide, please. Next slide, please. Thanks. So as a result of all this, we've got more children in school learning, children who'd never been to school, couldn't read or write at all, and now learning to do so. Discussions with the teachers at the schools they attend indicate that for the most part, they're doing remarkably well. Our remedial classes, which were not initially planned as part of the project, but which started because of the school closures due to COVID, are open to any additional community children who wish to attend, and several do so. It's also been a benefit for the children to have respected adult interlocutors to intercede on their behalf. So for instance, when we noticed that a little girl in one of our remedial classes had some injuries, we were able to investigate, find out that she was being beaten at home, and we were able to intervene to stop that happening again. Through continued discussion and repetition, we hope we're changing attitudes to children and education in the community. And a few parents have indicated that they'd like to start a small business with the skills that they've learned in our vocational classes. And we're hoping to put them in touch with a couple of microcredit agencies that we have been talking to. So in conclusion, and we can go to the next slide, you know, our project addresses one perceived need that the children have, the need for education. But the sum totality of their needs extends far beyond that. So for instance, even though they're now in school, they're still hungry. That affects concentration in class, leads to poor learning outcomes and truancy. They still have to walk long distances to get clean water. So ultimately, we can't afford to relent in the pressure that we put on the government institutions that are the only ones with the resources and capacity to underpin all of our efforts to help support children and their families and to address the inequalities in society. So thank you to the Consortium for Street Children and the lobbying organizations within this network that do just that. Thank you.
Fantastic. Thank you so much, Sally. Again, that's such a rich presentation, and I already have so many questions floating in my head. I'm sure everybody else listening to you does as well. So just hold on to those questions for now. We have another fantastic speaker to hear from, and then we'll open for some questions and answers. So Santigi, I can see you're ready. So Santigi, you're from the We Only Child Foundation in Sierra Leone. So can I hand over to you for our third presentation?
Thank you very much, Catherine, and thank you so much for my colleagues as well, and the entire team of CSC Network. Yeah, next slide, please. So We Own Child Foundation is working in Sierra Leone towards supporting street-connected children, especially girls, during the COVID pandemic. And then in doing that, we got funding from the Consortium for Street Children in collaboration with ABIV grants. So we got the funding, and then we reach out to street children, especially those living in the dump sites, and also cut off from the supports of government provided services. As you can see on the photos, you can see our team on the streets, especially on the dump sites, and also we provided hand washing facilities, soap, and also ensure that menstrual hygiene program is also taken care of or educated to the street connected children, because they live on the streets, especially the girls, and have no knowledge on menstrual hygiene, prevention, and also management. Next slide. So today, next slides, please. Today, I'll be talking about discrimination faced by street-connected children during the pandemic. As you can see, overview of some of the things we have done in Sierra Leone during the pandemic. We distributed hand washing stations in key locations where street-connected children are located. We also distributed face masks and then menstrual cycle management training and distribution of menstrual hygiene kits, distribution of hygiene materials also with regards to paste, other things that needed for the girls and other street-connected children to access whilst we are in lockdown, and also on other restriction of movement from one place to another. Next slide. This photos also tells you about some of the activities that we are doing, ensuring that street children, street connected children have access to hand washing facilities, because they need to have them into their locations where they are walking around, have a chance to move around. And so we also think about government releases of policies or restriction or updates, because we realize that street connected children have no access to Android phones, have no access to radio stations. So we have the only opportunity to provide them what government is saying, what they should do, what they should not do. So we collect those press releases from government and direction from government or policies, regulation, transform them into posters, and then paste them into strategic points where street connected children are located. Next slide, please. Next slide. Some of the success stories we have got is during our work, just specifically to street connected children, because we have done several other things as well with regards to feeding program for street connected children, working with other partners. But with specific to this, we sensitize 3 communities, in terms of hand washing and how they can prevent themselves away from getting the COVID-19, and also ensure that they provide some services for street connected children living surrounding their communities, like providing food for them, or clothing, or water. And also we reach out to 400 street connected children with our support services in terms of providing these messages and also providing food and other things that was supported by CSC, Consortium for Street Children, and also supported medication to 3 street-connected children and trauma counseling sessions, because we realized that in talking about the health of street-connected children, we provide trauma because we realized during that period, they find it very difficult to get what they want, what they need, and also to take care of themselves. So we provide trauma counseling as well, session, and then also the posters. And we provide posters for them to be able to understand what is happening within the community, within the country, in terms of government press releases, as I mentioned earlier on, and also in terms of government new laws and lockdowns as well, and also update them to the time that the government is about to lock down the country, and so they have to prepare themselves, getting food or getting what they need to get before the time comes. Next slide. Some of the challenges during our work is public lockdown, because during the lockdown, not all NGOs or individuals are allowed to move around. There's a lot of checkpoints around the city and key locations, and so you have to get pass from government. You have to apply for pass, and not all NGOs were given the opportunity to get those passes to be able to carry out their activities, and also even moving from one district to another. We also have more street-connected children that are available or need the support, but then the resources available was small for us to carry out our activities extensively. We also have problem with free healthcare challenge, because not all street and connected children age group that are also part of this free healthcare that government of Sierra Leone pronounced. So like the government of Sierra Leone always supports children under 5 age and also lactating or pregnant women. So there are along the line ages that are not covered with this policy, and they're affected by the COVID-19. And also fear of going to the hospital for to be declared COVID test positive. So many people, especially street-connected children, we are so afraid of going to the hospital to be tested, or to even when they are sick to go to the hospital to get medication, because fear of being tested and then being pronounced COVID and positive. Next slide. This is the end point of my presentation, but I'll also, as you can see the photos down there, you see some girls who were also part of the skill training center of our program, also supported by preparing this or producing a face mask, the reusable sanitary pad, and also you can see on the right-hand side photo, you see the counseling services that we are providing for girls as well, street-connected girls, that we are part of the program that we carried out during the COVID-19 pandemic. Thank you very much for listening, and thank you very much for giving me the opportunity. Thank you, the Consortium for Street Children UK.
Fantastic. Thank you so much, Santigi. That was brilliant. Again, such a lot of fantastic work that you've shared with us. So hugely appreciate it. And we have some time now for some questions and answers for our first 3 panelists. We have a couple have come in already. Sanjay, a couple for you that you might have spotted in the Q&A function, which we can turn to. But if anybody else has any, then please do either pop them into the Q&A box or let us know, send us a message and we can unmute you so you can ask your questions directly. But maybe just to start, Sanjay, would you be happy to answer the 2 questions that have come through? If you can't see them, let me know and I can read them to you.
Do I need to read question from the chat box?
Yeah, so there's first question for you, Sanjay, is from Sagar from Rag Dreams Weavers Association, a youth organisation working in Aligarh in India. And he's keen to know more about the OBE and how to register the organisation for it. So there's a question there from him. And then another question for you from Pia, who's also thanking you for the great presentation and was really interested in your 90% retention rate that you mentioned as part of your program. So could you tell us a bit more about how you managed the transition from alternative complementary approaches to education and to mainstream education, and just in how you monitor retention. Thank you.
Thank you. So for I would like to ask, answer the second question first, Pia's question. Thank you so much for that. Actually, what has happened, the learning came from our implementation of programs when we worked with Comic Relief. That was 12, 13, 14, 2012 to 14. And we had tried to admitted approximately 3,500 children in schools. And we did an external evaluation, and we found that there was a dropout rate of around 46%. So with this learning, we moved to an agency called Toy Box Charity. You all know that they are also member of CSC, and they agreed to support on that. And then we invented a program called Street to School, and there we tried to ensure that there is no dropout of these children from these schools, and we try to plug each and every problems which children have, which children were facing. For example, peer pressure, and they're not going to school, so we try to talk to the peers, we talk to the parents, we sensitize school teachers, we try to ensure that the girls are getting access to the toilets. So when these all barriers were addressed, the detention rate went up. So this is, and we have this street to school model ready to be shared with the entire world now. We'll be happy if anybody would like to understand the learnings. So that was first. I just forgot the first question. I'm sorry, Kathy.
No problem. So the second question was related to the OBE with your organization.
Yeah. Okay. Yeah. So Open Basic Education is a distant education in India, which is a part of the larger umbrella called National Institute of Open School, NIOS, National Institute of Open School. So any NGO that would like to have a open basic education, which is meant for children who would like to pursue their 3rd, 5th, and 8th class education. So it is a open education for 3, 5, and 8, for which you need to have a registration with for the OB center. And as I said, we have an upper limit of 200. The team will come and inspect your place where you will teach them. There is a minimum guideline that, for example, every child will go through 60 hours of mandatory learning, and the child should get some food and stationaries and everything by the NGO. And then the NGO will take the exam, and the children will get certificates. So the answer in a nutshell is that there is a process of registration and minimum standard which an NGO has to follow.
Fantastic, thank you, Sanjay. And perhaps if Sagar, if there was any further information you needed, perhaps Sanjay, you could share contact details together, and then maybe you can follow up offline. But thank you for answering both of those. Santugi, I have a question for you from Natalie. So could you explain a bit more why street connected children were scared to get a positive COVID test at the hospital? Is it because they would be put into isolation or stopped from working? Were they scared of the virus, or perhaps something else? So that's a question for you from Natalie. Yeah.
Thank you very much for the question, Natalie. I think you should all realize that Sierra Leone have gone through similar situation during the Ebola situation in the country, especially Sierra Leone, Liberia, and Guinea. We had a lot of issues, a lot of death, and a lot of problem, misinformation, and not corrected details. And so because of those loss of trust during then, and then similar things again comes up with COVID-19, and the same pattern of testing and also same pattern of prevention came up. So this is what exactly leads to street connected children being, so see it's difficult to go for test, because fear of being just given a negative thoughts about what is not correct or what is correct. And then, so these are all some of the, and so also again, government does not specifically, as I mentioned, provide a way that street connected children, of certain ages, which are not covered by the free healthcare, and can able to have free access or free health support from those hospitals. And so also the fear of being, being isolated as well is another thing, because getting food, they live on the street and they survive on the street, and then most of their caregivers or brides, what we call brides, those they trust, or sisters, female person who they trust in terms of asking for questions or asking for answers. It's not easy to get them around, and these are some of the things that made those street connected children afraid of going to the hospital for tests.
Thank you, Santigi. That's really insightful. Natalie, I hope that answered your question. Yeah, thank you, Santigi. I think I have one more question. I'm just checking if there's any others coming in. Sally, I have a question for you. Sally from Lifeline Nigeria. I was wondering, your project and your program sounds incredibly sort of well developed, and it sounds like you've learned a huge amount over the time that you've been running. I was wondering, if you were to start again now from afresh, knowing what you know now and reflecting on what you've learned, is there anything that you would do differently if you were to set up right now? Sally, I'd love to hear your thoughts.
Yeah, I think if we were to start a new project, we would probably put more upfront thought and planning into the remedial classes. I don't think when we started out, we fully appreciated the full extent of the gaps in learning of the children. So even though, for instance, they are now, we have placed them back in school, they still need a lot of help through the remedial classes in helping them to catch up. So I think if we were to do it again, we would start again, we would have done a lot more upfront planning for the remedial classes, getting the teachers in from the very beginning. Whereas with this project, we really only started the remedial classes because there was no school, but actually you need that as well. I think maybe one of the other things, perhaps, because, looking at all the other needs, we have done, I think, a fair amount of sort of collaboration with others, working with other NGOs. But, one of the things I'd like us to do more of is seeing if we can bring other NGOs into the area to address some of the things that we can't, for instance, like the water. Is there an NGO that helps to provide, to put boreholes in, things like that, and maybe sort of taking a broader view of the environment in which the children are living, not just the education.
Super interesting. Thank you, Sally. Yeah, fantastic to hear your reflections and your experiences. Fantastic, thank you. I can't see any other questions coming in just now, which is actually perfect because I think we're about on time to move on to our second part. So Sanjay, you may have to leave, but I think Sally and Santigi, you'll still be with us. So there's a question and answer session at the end. So if anyone has any further questions that you'd like to extend to Sally and Santigi, then please do keep them coming.
Can I request, Catherine, that we can open our cameras and take a picture so that you can put in your website if you are highlighting that we have met like this?
Absolutely, we can absolutely do that. Lucy, are you able to help us to just, if people who have all the speakers can briefly put on their camera?
I am so sorry, my webcam just is not working.
Yes, I can do. Give me 1 second. Apologies, Sally, that you won't be included in this. I'm just going to take a print screen now. There we go. That's done.
Fantastic.
I'll share that with you, Sanjay.
Great suggestion, Sanjay. Always good to have some memories, documented memories for us to look back on.
Thank you so much.
Really,
thank you. Bye.
Thank you, Sanjay. Fantastic. So for part 2, we have some more fantastic speakers for you. So this set of speakers will be talking about their advocacy work, particularly how they've been taking forward advocacy to really try and facilitate long-term change. And you're about to hear some really inspiring examples from the International Day of Street Children as well. So in this session, we have Sister Olivia Umar from Safe Child Advocacy in Ghana, and Iftikhar Mubarak from Search for Justice in Pakistan. So first up, Sister Olivia, if I could hand over to you, we'd love to hear your presentation.
Thanks. Thank you very much. And good morning, everyone, as we are in mid-morning in Ghana. So I'm really grateful to the consortium for having us on to share our experiences and to also learn from the experiences of the many great speakers who have already presented ahead of us. May I have a first slide, please? Thank you very much. So I'm speaking, as already been introduced, from Safe Child Advocacy in Kumasi, Ghana, where we work with children in street situations. Next slide, please. Okay, we are looking at barriers and how we have provided access for children in street situation, and also advocacy activities we've undertaken to provide access for children. And this is our outline. We look at one barrier that the children face, the levers, and what more can be done. Next slide, please. We're just showing a photo of a handful of the 20,000 children estimated to be on the street of Kumasi, lacking access to essential services and seeking access. These are children in our own drop-in center. Next slide, please. And we have identified a barrier, and the one we did identify because it is very outstanding also is the lack of access to formal education that confronts these children in street situation. And we are looking at access to early childhood education, to primary education, to secondary and to tertiary education. Next slide, please. And you can see the children in a deprived community. These are the kind of communities children that force children to take to the streets. You see the structure there is a school building provided by a concerned individual from that community who himself never really had access to formal education, but can manage to read and write and feels that he has a responsibility to provide access to the children. But because the environment is so poor and they lack all the things they need for education, the children would, of course, live for the street as they grow. Next slide, please. We identify the causes, which my colleagues who have spoken have already talked about. Poverty as the major causes of these barriers to access, unhealthy cultural practices, ineffective legislations, and of course, ignorance because the parents did not themselves have access to education and do not realize the value of education. They feel that the children are needed to be on the street to make some income for them. Next slide, please. Levers that we have undertaken to provide access ourselves is sponsorship in formal education and skill training to children in street situations and children at risk of taking to the street, and levers towards advocacy to ensure that barriers are removed for children to access essential services. The major one we thought we could talk about is marking the International Day for Street Children, which we have extensively done in the last few years. Nearly 10 years now, we have consistently marked this day, and it has become a very wonderful tool towards advocacy. We have undertaken these activities and listed the stakeholders forum to engage governments and other institutions in the society on the issue around children needing access. Petition to the presidency or the president, which we have also worked with the children and empowered the children to develop 2 years ago, which is making great impact. We've also undertaken press release to the government, formation of networks, which we actually has mobilized a lot of the networks, a lot of the organizations in Ghana that have any concern at all around street-connected children or those who work with street-connected children. We've come together to form a network, which we ourselves actually initiated and have continued to empower, and the network is gaining strength and able to speak with one voice and advocate. Through this network, we have seen the power of advocacy. Then child rights webinar we undertook last year, a march and float standing demonstration to draw the attention of the general public to issues around access for street-connected children, the social media platforms, making great use, extensive use of this platform to speak and to educate public, to sensitize towards the same issue around access for street-connected children. Next slide, please. And what's more to be done? We feel that we can't say we have done enough and we can do more. We think that public education is very necessary towards attitudinal change, because sometimes the people who use the services of these children don't see them as, useful. They don't have respect for them. And we try to see that we think we could do more to educate people towards changing their attitudes to these children, that instead of just using the children, we can help them access essential services, hold governments accountable through strategized advocacy, that our governments need to be constantly reminded that they have a responsibility towards the children in street situation, towards facilitating them to have access to essential services as child rights. Collaboration and networking with other organizations. We think this is very important, and we have to continue to work on this to mobilize more and more energy and force towards services to children in street situation, towards advocacy, educating children on their basic rights to services, because children themselves need to be aware that they have rights to these essential services, so that when they are offered opportunities, they can make use of the opportunity, they can embrace them and realize their potentials through those opportunities, instead of continuously allowing themselves to be used. These are some of the things we thought we could share on this platform around facilitating access to essential services for children in street situation. Thank you very much for giving us this opportunity, and we hope that we are saying anything that can be of any help to anybody. Thank you.
Thank you so much.
And we have can we see some of the photos of our activities, please, in the next slides? Yes. This is our photo gallery providing access, just showing the children who have been assisted. Can we see the next one, please? Any other place? Yeah, and below down and by the left, we have the Chief Executive of Adamfo Ghana providing laptops. So some of our young people whom we are supporting in tertiary education. That was a key activity that we carried out this year, early this year. Okay, you've already passed that slide. These are all showing access to education since we decided to talk on education. Yes, access to tertiary education. That's what I was talking about. It is in this year we really took on a number of young people to access tertiary education. So thank you very much. I think that's all of the photos. Yeah, and early childhood education, you can see some of the children we are supporting, and then skill training. And the last one by the right is a graduation of a number of girls early in this year who graduated from skill training and were given set-up items to start their business. And this is experience that has really given them not just access to skill training, but to employment now. Thank you very much.
Thank you, Sister Olivia. And it's wonderful to see your photos. They add another level to the insights you've shared. So thank you for taking us through those as well. I'm going to pass this on to our fifth and final, but certainly not least speaker, Iftikhar Mubarak from Search for Justice Pakistan. And then we will have another time for questions and answers. So I can see a few coming into the Q&A box already. So please do pop them in there and we will address those shortly. So Iftikhar, over to you for your presentation.
Thank you very much, Catherine. Thank you very much. So this is Iftikhar Mubarak from Pakistan, and I am representing a civil society organization, Search for Justice, which is mainly dealing with the child protection issues of children, including the children those who are connected with the streets. So I'm going to share with you some of our advocacy work over here for promotion and protection of the rights of street connected children. So please next. Next, please. Yeah, so we are a partner of Consortium for Street Children under the Red Rose Grant Project. And with the support of Consortium for Street Children, we are implementing a year-long project here in Pakistan under the title Promotion and Protecting and Empowering Street Connected Children. So mainly, as I mentioned, Search for Justice is a child rights advocacy focused organizations. So the slides which I am going to share with all of you are mainly reflecting our advocacy work. So this photographs is basically reflecting our engagement with relevant government departments like Police Department, Child Protection and Welfare Bureau, Literacy and Non-Formal Education, Primary Health, local government department, because keeping in view the mandate of the different departments, every department is responsible to perform their specific job, which is described under their rules of business. So usually in the current governance structure here in Pakistan, every department is working under their own given mandate, which we as civil society organizations sometimes consider that they are working in silo zone, and we need more comprehensive, more coordinated and more integrated approach to work with each other. So this photograph is just reflecting that with the support of Child Protection and Welfare Bureau, we try to engage different government departments to bring them on the one table to explore the possibilities how one department can collaborate with other to ensure that to ensure the provision of essential services, services of education, health, identity, protection to street connected children. Next, please. Yeah, so we used media as a great tool to influence and to lobby the decision makers. So that particular photograph is basically reflecting a newspaper forum which was arranged in a leading national newspaper, and we also involved the Ministry for Social Welfare in that forum, and we put all the relevant issues, the absence of educational facilities, the lack of education, lack of health facilities, the barriers and challenges in getting the identity documents for certificate connected children. I mean, we put all these issues in front of the minister in the media forum, and we asked him to share with us what are the strategic priorities of the government to remove these barriers and ensure that every child and no child is left behind, including the certificate connected children. So this newspaper and this, I mean, is having a circulation of around 1 million, which includes their print edition as well as their online edition, and the coverage was also included through their television, which is also a leading national newspaper. Next, please. On the International Day of Certificate Children, we also use the radio. So this photograph is basically reflecting one of our radio program, which we arranged on International Day of Certificate Children 2021. And through this radio program, again, the demands and action, I mean, demands for actions to remove barriers, to make sure that essential services for certificate connected children are available without discrimination by availing this platform. Next, please. Again, another consultation on what should be the way forward to ensure that children in certificate situation are provided the outreach services which are necessary, again, like educational services, health services, hygiene services, and other required and necessary services, engaging the government departments, media, and the civil society organizations. So we can make our demands with more strength, with maximum voices. Next, please. Again, another forum on the same forum, because we believe that one-time media engagement, one-time activity, one-time consultation is not going to make a very big difference. So we adapted the engagement with the media, consultation with the government departments as a key strategy, and of course, as a salient, I mean, a regular features that we will repeat our activities to get the maximum results from those activities. Next, please. This photograph is basically reflecting the briefing for the media personnel, and the good thing was that certificate connected children, 3 to 4 certificate connected children were also part of this media briefing, so they can share their issues directly in front of the media, so the media can prepare their stories, develop their packages, develop their documentaries to highlight the issues of certificate connected children. Next, please. So this was basically a mass media awareness campaign which was done on International Day of Certificate Children in collaboration with Child Protection and Welfare Bureau, which is a leading protection agency in Pakistan to deal with the issues of all sort of child protection issues, including the issues of certificate connected children. Next, please. So yeah, this is very important and significant intervention. So Search for Justice basically arranged an interactive dialogue between certificate connected children and the decision maker. So the lady in the mask you can see in this graph is basically the chairperson of Child Protection and Welfare Bureau. She traveled with us to visit the communities of certificate connected children, and there the certificate connected children basically presented a charter of demand to her that it is the government's responsibility to provide free and compulsory education, provide education, health and hygiene services, provide the protection services, provide the identity document to the certificate connected children. So these basically this charter of demand was presented to the high level political person, because being the Child Protection and Welfare Bureau's chairperson, she's also the special coordinator to Chief Minister on child protection. So this activity was basically designed with the aim to bridge the gaps between the certificate connected children and the government stakeholders. So it was in fact the very first meeting of its kind where a government representative traveled to the street communities to listen their voices, and we also provided street connected children an opportunity to interact with the chairperson of Child Protection and Welfare Bureau. Next, please. Yeah, so these are few achievements in result of our advocacy intervention, that because still what we are lacking is the absence of a comprehensive child protection policy. Because the child protection policy is totally not available. either it's it's the protection issues of the street connected children or of the children, those who are not on the street. So now the government has pledged their support to initiate the process for development of child protection policy in result of our department engagement with the Child Protection and Welfare Bureau. Now the government is also has set up a constituted working group of representative of different government departments, so the relevant department officials can sit together on a regular interval to explore the possibilities and how they can support each other, what are the collective issues, what are the collective challenges, and how the government functionaries can handle these challenges through their coordinated efforts. And of course, recently the government of Punjab also announced that the government will set up more child protection units to provide the protection services to the street connected children, and of course the other children, those who are the victims of violence, abuse, and exploitation. And now the government is basically pledged to maximize their outreach and to expand their protection services to the other districts of Punjab. So there are basically few highlights of the achievements we consider that are our achievements, or that can be considered as immediate results of the advocacy interventions with the stakeholders. Thank you very much.
Fantastic. Thank you very much, Iftikhar. Again, really comprehensive and incredibly inspiring to see what you've achieved through all of your work, and some fantastic examples, which I'm sure will inspire everybody who's been listening. So thank you very much for sharing. So we have now time for another question and answer session. And I'd particularly like to start with questions and answers for Sister Olivia and Iftikhar, based on the two presentations we've just heard. But we do still also have Sally and Santiki with us, so we can also reflect questions to them in a second. So just to kick us off, we have one question in already for Olivia from Pia. So Sister Olivia, Pia is saying it's amazing to hear your 10 years consistent celebration of the International Day for Street Children. Thank you for sharing that and for the rest of your great presentation. Over that decade, so over that 10-year period, what do you think is the biggest advocacy success that you've achieved? So Sister Olivia.
Thank you very much. Thank you very much for that. The biggest advocacy success, we would say, is the fact that we've awakened the government of Ghana to the reality. They actually knew the reality, to pay attention to the reality of children in street situation in Ghana. And it was actually an activity of International Day, or celebration of International Day, that made the government to begin to mark the International Day. When we sent them an invitation one of the early years to attend our stakeholders forum, we realized that beside attending the stakeholders forum, they also started organizing to celebrate, to mark the International Day and to raise awareness. Second success we would say is that we've been able to mobilize the network of organizations working with street-connected children and those concerned about street-connected children to join in raising our voices, making our voices heard on the International Day, and that has given birth to a network of organizations growing up in Ghana. It's becoming quite strong, and it has become an advocacy body. It's serving the government around street children issue as we speak.
Wow, that's really impressive, Sister Olivia, fantastic. Fantastic. Iftikhar, I see you've unmuted. Would you like to offer an answer to the same question?
Yeah, so this is very important to share here that back in 2010, there was a constitutional amendment in the Constitution of Pakistan. And under this constitutional amendment, all the provincial governments are now empowered to make their own policies, develop their own child protection legislation, develop their own action plans to ensure the protection of children, no matter they are the children on the street, off the street. So the big advocacy achievement and advocacy success, which I can share with all of you, is that still, I mean, since 2010, and this is 2021, 2021, till the province of Punjab, which is the largest province of Punjab, Pakistan, as per the population, because more than 60% population are living in Punjab. So Punjab province is basically not having a child protection policy at the government level. So now the government has pledged and assured their support that the government has, and of course they also have initiated the process for development of child protection policy with the technical support of the UNICEF country office here in Pakistan. We consider as a civil society organization, this is a major achievement in terms of advocacy intervention, that now the government is basically realizing the importance and significance of having a comprehensive child protection policy and a strategic action plan to ensure the protection of children on the street and children off the street. So that I think is a big achievement.
Thank you, Iftikhar. Brilliant to hear. And just a related question that has come through, which also links to a question that I had. This is a question from Claire, who's also thanking you for your great intervention and asking if you could tell us how you managed child safeguarding during the consultations that you led with the media. And I had a similar question. I was also wondering how you gain and sustain trust of the children that you work with. So child protection and that ongoing engagement would be fantastic to hear.
So in fact, in our project intervention, there are two parts of the project. One was basically to assist the local communities. I mean, we are also having, and we are, managing a non-formal and basic education, that we call it basically a learning center. So we are providing the learning opportunities for 2 hours in a day at a community of the street children, which is big. You can consider it the biggest community of the street children and the people, those who are living on the street and working on the street as well. So we work in those communities through our social mobilizers, which regularly visits the community. We regularly arrange the free medical camps to provide them free medical checkups and the medicines. We also provide them technical and vocational education opportunities and facilities. So we provided some sort of like the food items support during the peak days of the COVID back in March and April 2020 when the COVID was initially started. So basically those community-based interventions helped us to gain the trust of the children and their communities. So we regularly worked with the children, and the children, those who are basically interacted with the media, they are basically the student of the learning center as well. So we took their parents in the confidence, and we provided a detailed orientation that what is the significance of the media briefing, and when the children will be speaking by their heart, so it will be more attractive, and it will be more result oriented for the media to report it. When a street connected child himself or herself is speaking about their own issues, so it will be more buying. It makes their case more attractive and more worthy in our opinion. So we brief their parents, we brief the children as well. It doesn't mean that we pick the children and we offer them to sit in front of the media. It includes the comprehensive trainings, like it included 2 weeks training where the children were trained. We arranged different mock sessions with the children, how you will talk with the media, what question they can ask you, and how our team will be supporting you if you will not be having any answer, if the media people will be basically asking you. And because Search for Justice is having a child safeguarding policy and a comprehensive child safeguarding policy and code of conduct, so even during this media consultation, the children were also accompanied by their parents as well, because they were the children, those who were working on the street, and they were also having, and they are living with their parents as well. So their parents, their father basically accompanied the children. The fathers of the children accompanied accompanied them while we were interacting with the media. So, and in addition to this, we also ensured, because the media people are those with whom we are also regularly working. So they are now sensitive enough in terms of, you can say that now they are the child sensitive media people. So we try to ensure, and we try to involve and engage and invite those media people, those who are from the reputable and the renowned media outlets, keeping in view the significance and sensitivity of the issue. So that whole process is basically adopted to ensure and to keep it on top of the line that the well-being and safety of the children is more than, I mean, is very, very, very much important for such justice.
Thank you, Iftikhar. That's a incredibly useful and comprehensive answer on a really important issue, of course, around child safeguarding. So thank you. I wanted to also just open up that question to Sister Olivia, Sally, Santigi, in case any of you have any reflections that you also wanted to share related to how you approach the really tricky issue and important issue of child safeguarding in your projects.
Yeah, one thing is that all of us are trying to, find a way, solutions, in a different form, in a different pattern to ensure that we support street-connected children. Despite all the challenges that we face during the COVID-19, but yet still all of us are working together in our different communities to find a solution to address the problem or the challenges that we are facing. Adapting and flexibility, just as part of the recent forum network that we just did. I think it's really important because at the time of COVID-19, we are faced with different ways and we try to adapt, different programs have been cancelled or even opportunities that was on the pipeline, we are all cut off. And now we are faced with downfall of the funding support, but yesterday we managed, we are trying very hard to find a way to support those children or beneficiaries that we work with. Thank you to Consortium for Street Children for coming in at the time of really, really difficult time, working together with the Red Nose Day USA and also ABIV to provide funding for network members to continue supporting street-connected children in our various communities. For us, it's really, it has been so difficult because when we are working within the communities, especially for children living within the dump site, when we share the information that this is what we are doing within the dump site, in the SLANGO, which is the Salon Association of Non-Governmental Organization, it was like people were saying, "Oh, great! No one should be left behind." So this clearly shows that yes, it was a good choice and a great decision for us to focus our work to street-connected children, especially those living in the dump sites. That have no, all those syringe, other things have been deposited there. And if they do not have the education, the sensitization, the information that they really need to get, it's tantamount that they will get more even, they will be the one to bear the greatest disaster. So I think all around, and they will also spread it over to other people because they move. Street-connected children does not stay in one place, they move from one point to another. And that makes it very important that no one should be left behind in terms of educating them about COVID-19 and providing services that also they need to get as citizens. We always consider, we have had several challenges in terms of being a citizenship or having documentation that shows you who you are and what you do and how you can able to have access to those. Unfortunately for street-connected children, it's very hard for them because during all these kind of opportunities coming in, they still don't have documentation, and they still, they don't have the authority or power or means to getting other support that they need. But to all the team, thank you very much for all your efforts and all our strive, one way or the other, to get things done the best way. And now we have done so much, and this is what we are sharing. And I believe all the stories that we are sharing, other colleagues, other members, other organizations will also be using them or try to join our network to grow it together and reach out to more street-connected children. Thank you.
Thank you, Santigi. Thank you. Sally, did you want to come in briefly?
Yes, just very briefly, just to say that, when we hold our seminars and discussion groups with parents, we make sure that topic of child protection, child safeguarding, child rights is a part of the discussions. And we also include the community leaders, or we'd call the elders, the local chiefs. And we've had similar discussions with them as well, so that they also understand the protections that the children need. And we give them information as to who they can go to if they need assistance, the local government child protection officer, ourselves. And then in addition, when we have our remedial classes with the children, on a Friday, we do sort of other activities, not just academic activities. And we also have talked to them about their rights and what they can do if they need help, where they can go to get help, and encourage them to, to let us know if there is anything that they need, if they're in danger and so on. Which is one of the best things, I think, about the remedial classes. It gives us an opportunity to be adults who are friends and who can intervene as necessary. So sort of two-pronged, with the parents and the community, and then with the children themselves.
Fantastic, thank you, Sally. A huge amount of time and trust building invested there, which is clearly paying off in your work. So thank you for sharing those experiences. We have one unanswered question in the chat, which, Iftika, I'm just going to draw your attention to. I might suggest we tackle that one offline, if that's okay. Just I'm conscious of time and would like to have chances to celebrate all the speakers today. So Iftika, if you can see that, perhaps you and Pia could follow up if that's okay. But I just want to say a huge thank you to Sanjay, Sally, Santigi, Sister Olivia and Iftika for their presentations today. I hope you all agree, a wealth of information has been shared. I've learned a huge amount, and I'm sure you all did as well. A few very quick takeaways, which I'm taking away from this session. Some of the learnings I'm learning include just how important it is to empower street connected children through enabling that access to education that we heard so passionately from Sanjay and the Chetna team in India, with their specialised curriculum, enabling access, addressing stigma, addressing challenges related to menstruation, etc. And I think their results and their numbers speak for themselves. The importance of collaboration with community leaders, parents and family carers, and Sally, you just talked about that fantastically again. The importance of making them stakeholders in the project and how that's particularly critical to building up those levels of commitment in the community, and really helps you overcome some of the barriers that you're facing, including with family attitudes. Also taking away those particular challenges and the discrimination faced by street connected girls and young women, and what can be done to tackle it. So huge thank you to Santigi and the team at We Only Child Foundation in Sierra Leone for sharing with us their experience, including in the really tricky, challenging time of the global pandemic, and the work they've done, including through menstrual cycle management training, distribution of menstrual hygiene kits, among many other things that they do. Brilliant ways to utilise the International Day for Street Children as an effective advocacy moment. Fantastic work from Sister Olivia and the team at Safe Child Advocacy in Ghana. And particularly related to that, I'm taking away that importance of grassroots engagement to encourage attitude changes, the importance of holding your government to account, and that important collaboration and networking aspect. And then finally, how to meaningfully engage street connected children in advocacy and in your program development, but particularly from Iftika and the team at Search for Justice in Pakistan, the brilliant advocacy they've been doing and the interactive sessions and meetings convened with government and street connected children, which have enabled children to raise problems and request directly themselves. Really inspiring from all of you. So huge thank you, and thank you to everybody for joining today and for your great engagement. Coming up next, because as you'll know, this is one in a series of fantastic sessions that we have for you this week. Shortly, in 30 minutes time, which is why I'm keen to end on time to give everybody a little bit of a break, is our AGM. So that is open to all network members. It's a Zoom link webinar. In order to vote, you will need to have registered with Poll Everywhere, so please do make sure you've done that. If you have any difficulties, please just contact one of us at the CSC team and we will help you. After the AGM, in 2 hours' time from now, we will be introducing the redesigned Digitally Connecting Street Children platform. So I'd really encourage you to join that session. And then, Lucy, if you just flip to the next slide, I think there's a couple of other quick ones to highlight. Tomorrow, there's a mental health and trauma awareness for street connected children session. And as the speaking in one voice, advocacy and collaboration session tomorrow as well, on Friday, sorry. So one tomorrow and one on Friday. And many other sessions which we hope to see all of you in. So huge thank you again to all of the speakers, and thank you everybody for joining. I hope you agree it's been a really fascinating session.